Hi, I'm Dr. Sarah Mukowski, one of the physicians with Dallas IVF. Oocyte cryopreservation, more commonly known as egg freezing, is a laboratory technique that allows women to store eggs for future use.
These eggs can then be thawed months or years later to then be fertilized with sperm and create embryos. The resulting embryos can be then transferred back into the woman's uterus to achieve a pregnancy. Women now have the opportunity to delay childbearing for years.
As women age, both the quality and quantity of their eggs diminish. Therefore, it would make sense to preserve young, healthy eggs for later use, before the ovaries' reserve is diminished. Previously, due to limits in technology, egg freezing was considered experimental, and freezing of fertilized eggs or embryos was the preferred method for fertility preservation.
However, with the technological advancement of vitrification, or ultra-rapid freezing, the survival of frozen eggs has greatly improved and the procedure is no longer considered experimental. Egg freezing is now a standard practice at Dallas IVF.
Historically, egg freezing was performed mostly in women with medical conditions affecting their reproductive future, such as cancer patients undergoing chemotherapy and radiation treatments. However, now this procedure is available to many women for a variety of reasons. Some couples needing IVF may not want to freeze embryos for religious reasons, so a limited number of eggs can be fertilized and any additional eggs frozen for future use.
In addition, many single women may choose delaying childbearing until later, perhaps planning until after personal and professional goals are met.
At Dallas IVF, the most common candidate for egg freezing is a single female in her mid to late 30s who currently does not have a partner. The process of egg freezing is very similar to that of in vitro fertilization, or IVF, minus the fertilization part. Women will be required to take fertility injections and undergo monitoring over a period of about 2 to 3 weeks. When the ovaries achieve maximum stimulation, the woman will undergo a minor day surgery procedure to retrieve the eggs, which usually lasts less than 30 minutes. Most women are advised to rest the day of surgery and are able to return to work the following day.
The eggs are frozen a few hours after the egg retrieval. While not every frozen egg will result in an embryo, younger eggs are more likely to have successful fertilization and resultant healthy pregnancy.
If a woman is not a good candidate to conceive with IVF now because of her ovarian reserve or age, she would not be considered a good candidate for egg freezing at this time.
Women, especially those in their mid to late 30s, who feel strongly about having children in the future but don't expect to have children in the next year or more, are encouraged to consider freezing their young, healthy eggs as an insurance policy. We at Dallas IVF are excited to offer this procedure to those women wishing to preserve their fertility until they feel the time is right.